Okay, good afternoon, everyone. I hope you can hear me. Bonjour to all of our guests joining in from France. A very warm welcome from the Indo-French Chamber of Commerce and Industry. We are very, very delighted to be organizing this webinar today on the current growth drivers and technology trends in Indian healthcare. Welcome to all of you. We're very excited because we have a great panel put together today, and I'd like to take a moment to introduce them to you in a while. But just very quickly, a few words about our chamber. The Indo-French Chamber is a 40-year-old chamber of commerce. It's the official bilateral chamber between France and India. We currently have 5 offices in India, in Delhi, Mumbai, Chennai, Bangalore, and Pune. And we represent a network of close to 700 member companies. It's a full-serviced chamber, so we provide a number of services and activities for our members, from events to advocacy, to communication and promotion, to business support services for French companies in India. Notably, I'd like to mention we have 4 business centers. We offer staff outsourcing, and we also have a separate division that focuses on HR and recruitment services. So I'd just like to take a moment to introduce our panelists. I'm hoping you can all see the slide. Yes, so we have with us Mr. Ravi MENON, who is a senior business advisor for APAC healthcare at Nexdigm. Thank you so much, Ravi, for being with us. He will be giving us an overview of the market and opportunities in the sector in India. And then we will have 2 testimonials. We have Mr. Charles Biard, who is the Chief Financial Officer for India and South Asia at SANOFI. And then we have Mr. Prabhdeep Singh, who is the CEO and co-founder of STANPLUS, which is an Indo-French, I would say, startup venture in the healthcare space in India. And it's a great story. So thank you very much. And perhaps I will stop sharing now and I'll ask Ravi to take over. Thank you.
Thank you very much for that introduction, Payal. And my name is Ravi MENON. I work with Nexdigm as the business advisor for healthcare. And I'm delighted to be here with you this morning. Good morning to all of you, and thank you for joining us on this webinar. So let me first share my screen. Can you all see my screen? Can somebody confirm? Okay, good. Thank you. So I will spend about 20 minutes in my session talking about emerging trends in healthcare, especially in terms of healthcare technology. And I plan to give you an overview of our Indian healthcare scenario and the industry, look a bit at the healthcare technology market in India, and point out some emerging trends which we are seeing in the market. I do have some case studies. I'll spend a bit of time on one case study and conclude with some summary takeaways for you. If time permits, I would spend a couple of minutes telling you about Nexdigm and our company. Let me begin by looking at the healthcare infrastructure and the overall scenario in healthcare in India. And for your interest, I've also compared it with France. So you have a very developed healthcare market like France. And what you're looking at in India is an underdeveloped market. So we are still a developing country. And as you can see across a number of parameters, our parameters reflect a much lower level of development. So if you look at doctor density, we have less than 1 doctor per 1,000. If you look at insurance coverage, there's only about 60% of our population which has some kind of insurance cover. Our healthcare spending as a country is pretty low. So we spend about 4% of our GDP on healthcare, of which government public spending is only about 1 to 1.2%. So the rest is actually personal private spending. So, and as a consequence of that, you can see that our out-of-pocket expenditure on healthcare is extremely high. So 65% of the expenditure on healthcare comes out of people's personal pockets. This certainly has implications for a number of in a number of ways. So it has implications on pricing, access, affordability, combined with the lower availability of quality insurance. These two make us a challenging market in some ways, though there has been significant growth in insurance in the past few years, and we hope to see that continuing as we go forward. Due to the growth of the economy over the past many years, COVID pandemic notwithstanding, we've been a healthy growth market with the GDP growing, in the region of 7 to 8%, rising middle class and large sections of population getting thrown into the middle classes, which has helped our market grow. So we've been seeing double-digit growth on the healthcare side. Now, and lastly, if you look at beds, you have much lower beds per population in India. So we are at 1.3 compared to 6 in France. So clearly this is an underserved, underpenetrated market. The key takeaway is that I think there's still a lot of growth in the market left. There's a lot of improvement in penetration required. On the flip side, there is the quality of care and the access to quality care in our country still needs a lot of improvement. The other point I think which is worth noting is that the disease profile in India has been changing very significantly in the last 2 to 3 decades. So here, on the left side, you have a picture of what the disease profile looked like in 1990. So in 1990, the major causes of mortality were infectious diseases, maternal illnesses, infant mortality, neonatal problems, nutritional diseases. And the pink portion, which you see here, the magenta portion, which was under 40%, was the non-communicable diseases. You also had a significant growth in life expectancy in the country. So from under 60, we now have over 70 as the life expectancy, and it continues to rise slowly. So overall, the health of the citizen has improved, but the disease profile has totally shifted to one that looks pretty much like what it would in the Western developed world. So you have non-communicable diseases, or NCDs, now accounting for over 60% of the mortality in the country. Communicable diseases have fallen sharply. Injury-related illnesses continue to be fairly high in the country, almost 10% due to injury-related mortality. So the shift to diseases, the leading communicable diseases in the country are cardiovascular diseases, metabolic disorders like diabetes, and a very surprisingly large growth in oncology and cancer as well. In addition, you have urogenital problems, the kidney-related issues, and you have neurodegenerative diseases, neurological diseases, all of which are beginning to be seen more and more in our society. This does mean that people's diseases need to be managed over much longer periods of time, and the public health infrastructure today is not well equipped. They were geared to take care of primary healthcare and mainly manage infectious diseases and maternal neonatal health. Today, they have to manage NCDs, which is a total different cup of tea. So that I think NCDs also have a greater opportunity for technology-related innovation to play a significant part in providing good solutions for the customers. This slide gives you an overview of the healthcare industry in India and its sizing. So in 2019, we were approximately at 168 billion USD market. It has been growing double-digit over the past few years, and we expect this number to climb to in the region of $350 to $400 billion by 2024, which is a CAGR, or an annual growth rate of 17 to 19%. We can look at our traditional segments in the market. So the largest is clearly healthcare delivery, which is your clinics, hospitals, and all those service points, which is approximately 123 billion, or 73% of the market. And pharmaceuticals are the other large portion, just under 20% of the market, which is about $32 billion. And $32 billion at fairly low prices. So I would say the penetration of pharmaceuticals in India is significantly higher and much better and reasonably good compared to that of med tech, med devices, and diagnostics, which are still comparatively much more underserved and underpenetrated. So you have med devices at about 4 to 5%, and diagnostics also in the 4% region. Additionally, a point of interest, which is that during the last decade, India has received just under $25 billion worth of FDI into the healthcare industry. So you do have a very vibrant healthcare industry and a growth industry. So there's been interest from investing public in private equity, venture capital, in addition to FDI from, well-established commercial entities and companies across the globe. So that's a kind of an overview and snapshot of the healthcare industry in the country. Moving on, let me just move on to healthcare and tech in particular, and give you some details here. So we've defined healthcare tech, health tech as the combination of new technologies, healthcare apps, information sharing, delivery services, telehealth and remote, AI and AI ML related applications. So we've bucketed all this under the health tech market. And this market is still a very nascent market in India. It's just about 1 to 1.5% of the market by what we can estimate. However, we do believe that there's an ecosystem evolving which is very favorable for this market ramping up very quickly in the mid to long-term perspective. So if you look at the division of the market here by certain categories, you'll find the large ones are aggregators. So you have aggregation in pharmacies, a number of other services, and these aggregators are actually about a quarter of the market today. Healthcare apps for personal health and fitness is another large category, about 20% of the market. You have diagnostics at around 15%. You have health information related services at about 17%. And some of the others like categories which include medical tourism platforms and some of the more esoteric categories are much smaller currently. So that's kind of what the pie looks at from the vertical perspective. In terms of technologies, you have mostly the traditional technologies are about 3/4 of the market, the conventional ones, which are your app-based technologies, mobile technologies, telehealth and teleconsulting technologies. And then you have the newer technologies, which include AI, ML, IoT applications, and blockchain, which are still new and much smaller in size. And I have something later which I'll show you where we think we are in the evolution process. From a business model, bulk of the health tech applications today are consumer focused and they are B2C models, but you have increasingly some B2B health tech applications also coming into the fray. So you do have a fairly widespread market, which with a variety of products and services that you see similar to many other parts of the country, though I would say the penetration and utilization is still nascent and developing. So what do we think are the growth drivers and the impact which are behind the health tech market interest? So some of the growth drivers we already talked about in the general healthcare scenario. So you do have the shift in disease burden to the NCDs and the longer treatment horizons that those involve. So I think that significant changes in disease profile has triggered innovation in the health tech space, because these diseases are now need to be managed over many, many years for the patients. The patient is interested in examining how they can manage their conditions and their wellness over a long period of time. The physicians have a similar interest, and the healthcare providers have a similar interest as well. So the NCDs are certainly a very significant part of the growth drivers. You do have economic growth and the rising wellness concerns across society. So in addition to acute illnesses being cured, people are now looking at how do I maintain good health. How do I prevent my disease from getting worse? And how do I manage my life in such a way that I can minimize the impact that my disease has on me over the period of my life. And, rising incomes, the growth of media, you do have, the large globalization of information is certainly triggering a focus on improved quality care and the variety of care that models that are available in the Indian consumers. So Indian consumers today are more discerning. They are looking for greater value. They want to be the center of products and services that are being developed. And that's, I think, some of these are fundamental changes which are occurring in society, which are serving to drive the growth in the healthcare sector. We do find a rapid adoption of EHR solutions, particularly in the hospital space, where health information systems and health record maintenance is significantly improving. There's still a long way to go in terms of connectedness of and interoperability of systems, but at least many of the private hospitals now have good hospital information systems. There's widespread, India is an IT oriented country, and there is widespread implementation of cloud computing across industries, and healthcare is no exception. So that will lead to improved access to data for both providers, intermediaries, as well as patients. What we talked about earlier, that patient-centric technologies like patient portals, fitness devices, home healthcare, mobile-based health applications. Many of these are seeing increased demand, with the customers do use Google extensively, and they also want now applications on their mobile platforms, so that mobile devices which can help them manage their wellness and health better. And we already talked about the NCD mortality rate and the drive to manage health better being with their chronic diseases growth in the society. So going a little further into where do we see this the evolution of our health technology ecosystem. So this chart basically shows you the maturity of various applications which and healthcare products and technology solutions which you see in our market. So we've classified them in terms of maturity into launch, growth, and consolidation. Consolidation really doesn't reflect consolidation which you would see in the Western world, but at least we think they're more mature than some of the other technologies. So at the area of consolidation, you have, I think mobile apps, activity trackers, wearables, and some personal health data applications are fairly well penetrated now, but I think there's plenty of scope for them to get utilized better, to consolidate and to integrate with the other healthcare services in the system. Then you have another sector of technologies where we think they're still awaiting growth for scale. And I think in the next 2 to 3 years, many hospitals will start using these in significant ways. And we should see a huge jump in the utilization of these services. So these include genomics, they include artificial intelligence, robotic surgery, AR, augmented reality and virtual reality solutions, and also an improvement in EHR. So at least in the private sector hospital space, we do believe that over the next 3 years or so, there'll be a huge spurt in adoption of all these technologies in that sector. And at the low end of maturity, we do have technologies like blockchain, where we are beginning to see a little interest, but still not significant penetration or usage. Advanced implantable technologies, IoT-enabled bionics kind of products, which are implantable. Many of these are still very low adoption, and I think it's still kind of proof of technology awaited there, proof of clinical value awaited there. Whereas I think in the growth and consolidation, people are already seeing the value. It's a question about getting the, sizing up the utilization and consolidating those things. I think the focus has been on improving access for patients. So India is a very diverse country. It's better looked at as a group of countries with fairly different socioeconomic profiles, health infrastructure, cultural norms, and geographical variations as well. So improving access, improving quality of care, just improving the information availability and portability of information are all driving evolution in these segments, as is the demand from the patients for increased engagement with their care, with their physicians and care providers, and also to have better information flow. So these are some of the key drivers of evolution. And we do see, all this leading to certain trends, which I think around which product opportunities or solution opportunities exist. So one is we are clearly seeing a need for disease-focused applications. So there are a number of diseases like metabolic disorders, cardiovascular ailments, where patients of these diseases are seeking applications and solutions which can help them manage their disease better. So there are companies looking at disease-focused products and services, and I think this trend will grow. Telehealth and telemedicine has been around for a long time, but we do think it was utilized for a long, and COVID has given this a big impetus. So I think patients are really getting used to the idea that they are comfortable now talking to their physicians online, hopefully with a video link. But there is now, I think, scope to improve the product and service across telehealth, improve the quality of the communication, improve, probably image flow, diagnostics flow across, the time. And this has huge impact in the country because access differentials across the country are huge, and these can help bridge that gap. Similarly, the Internet of Things, the growth in sensors is, as the need for remote patient care increases, I think we are going to see increasing demand for IoT-enabled devices and applications, so that physicians can access patient records, patient health data remotely. And there's also a tremendous need for connected care. So people are demanding care now closer to their homes, and they want, if possible, home to be the point of care rather than the hospital or the clinic. And this means that you need to have connected information systems and connection with both the care providers as well as the insurance payers as required. AI, machine learning, this has applications across diagnosis, across hospital management, across care management, and we are seeing a number of applications beginning to be tested out here. And as the consumer gets more digital, and I think the digital and customer engagement will spread across areas beyond the physician and dialogue or healthcare apps. I think companies will also try to reach customers for marketing purposes, engage with them digitally, customer portals, information systems, all that would need to serve our customers better. So these are some of the key trends that we are seeing. There are a number of cases of successful healthcare companies in India. So I don't want to I have some slides here. So if you get hold of the slides later, you can see some other case studies, but I'll just talk about one today, which is Portia. So Portia was started, 7 to 8 years ago. Primarily, they saw the need for home health care as a key need, and they began operations in Mumbai and Delhi. Today, I think they have more than 4,000, 5,000 people in the company, and they provide doctors, nursing, physiotherapy at home for their elderly patients or non-mobile patients. They provide lab services, post-operative care. They can provide medical equipment on loaners. And as a consequence of their home care operations, they've also now acquired other businesses in the vertical. So they've acquired a pharmacy aggregator, and they're acquiring some more companies. And you can see here, they have a number of venture capital investors who are interested in. So this was founded in 2013, but has become a good success story catering on home health care. And I did mention we have a number of other case studies, but I won't talk through this right now. And I will leave this deck with you as we go forward, so that you can look at these on websites and get a little more information if you're interested. So in conclusion, I'd just like to make some broad summary comments. So I think in India, you have an underdeveloped and underserved healthcare market. So the good side of that is, I think it's a market which has very good potential for long-term growth. And it's also clear that our 21st century healthcare problems need technology-enabled solutions. And it is these technology-enabled solutions which will help us leapfrog to the desired state that we wish to have for healthcare, the state of care and access in for our citizens. Technology can definitely help improve access among the vast underserved populations, so both geographically as well as cut across socioeconomic boundaries. And we are also seeing that some of these technologies can work very efficiently, helping manage cost in a way that you get better price points, which will again widen access and make care available to more people. We do have a rapidly evolving ecosystem, and I think that supports innovation. And actually, funding has, pre-COVID, the funding available for healthcare startups was fairly good. So it's been, a very supportive system. And that's why today you have a market landscape which is active with numerous players offering a variety of products and services in the various segments that we talked about earlier in the presentation. Smartphone penetration and data usage have become very powerful enablers of support. The growth of data has been unprecedented, actually, and I think that's what's going to help the country leapfrog and drive the acceptance of modern health tech related, embedded services as compared to traditional care. And I think COVID-19, unfortunate it is, and I think the impact of that is still very uncertain. So I'm not actually getting into that, but it has changed people's mindset to adopting technologies quicker. And I think this change is here to stay, and we will see our populations being more amenable to using this technology. There is therefore a rapidly growing market opportunity for health tech products and services, I think. But India is a challenging market and one that is very diverse. And I think people who are interested in the market need to plan to be here for the long term, enter the market and learn its nuances and build their market with a strong understanding of the nuances of the market. Disease patterns, growing incomes, I think all these will support rapid growth in the future. So thank you very much. Just one line about Nexdigm. We are a multidisciplinary organization offering services across business consulting, business services, and professional services. And I will not take any more of your time on this. I would, but please do reach out to us with any queries you may have on any solution regarding the Indian market. Thank you. Thank you very much.
Shweta, you are on mute.
Thank you, Ravi, for this insightful presentation. It was really informative, and I'm sure the participants will have a lot of questions coming your way. Without further delay, I would now like to ask Mr. Shal Biar, the Chief Financial Officer, India and South Asia of SANOFI India, to please present the success story of SANOFI in India. Thank you.
Thanks. Good morning.
Over to you, Shal. Good morning.
So I'll go through a few things in a short time frame. First, I'm going to present quickly what is SANOFI doing in India. But then I wanted also to take a few minutes to share some kind of external perspective on the Indian markets. Why, what are the reasons why it's interesting? What are the complexities also, and not only what we are doing. So very quickly, SANOFI, is focused on a few areas. We have a big vaccines division, which obviously is quite busy these days in terms of development, you would expect. We do have also a strong presence in specialty care, treating multiple sclerosis or rare diseases. Then we have a general medicine unit, which is more like primary care units, including diabetes, cardio, hospital treatments. And then we have a consumer business also. So in India, we actually have a very old history. SANOFI has been present in India for more than 60 years. It's not a huge business compared to other markets in terms of sales. We do 500 million euro more or less in India on a total for SANOFI of close to 35 billion euros. I mean, most of this is due to the pricing situation in India that I will detail later. We operate through different legal entities, including one which is listed in NSE and BSE, which are the stock exchange of Mumbai and Delhi. And in total, we have 5,000 people. So this includes commercial activity, but also different industrial sites. We do produce vaccines in India, and also some pharma products. So it's quite a broad presence and a long history with India, which actually started from before the Sanofi and Aventis stories. And both actually groups were present before the merger that happened 15 years ago. So just to give you a few numbers because the million euros are not really a representative of what it means. In India, we vaccinate, India is vaccinating babies with our products, 21 million babies every year. So, that's one number to put in perspective. If I take another treatment, which is Lantus, which is our, insulin, we have something like 700K patients taking Lantus right now as we speak, probably a bit more today. It's important to know that India is unfortunately one of the fast-growing countries in terms of diabetic patients. We estimate that there are probably something like 70 million to 80 million diabetic patients in India, which is more or less the population of France. Then we have several hundred patients who are treated through a rare disease product, more than 100, by the way, on a charity program. And then the Combiflam, which is our local Doliprane kind of equivalent, we sell 5 million tablets every day. So if you take the full year impact, we're talking about close to 1.5 billion tablets sold every year in India. So that's quite a number. You could wonder. I'm not going to spend too much time because all of this is available on the website. Yes, we're very active on the fight against COVID. Obviously, there is the two vaccines that we are currently developing. We also are working with Luminostics on finding a smartphone-enabled diagnostic for COVID. And there are other activities. I'm not going to detail them, but what's important to keep in mind is that India's COVID onset was a bit chaotic because the early days were difficult to. It was difficult to understand what was the recommendation from the government on what could or could not be done. But fortunately, we were able through the crisis. From day one to today, to maintain production of essential drugs in all the manufacturing sites, and to make it available for patients. I'm not going to go across. To spend time on the pharma market itself because I think Ravi did a very good overview of it. The one important thing that I want to retain is that basically, as many big emerging countries, we had a history of a lot of communicable disease burden, which is unfortunately being taken over very quickly by chronic therapies. Chronic diseases and non-communicable diseases. Obviously, diabetes is one of the main one, but there are more, and it's a trend that is expected to continue for different reasons, which are similar as the ones we see in China and other countries. So what's interesting in the Indian pharma world, the government has been pushing a few things to increase the access and affordability that I want to describe because it's a good overview of what you find when you enter into the drug markets in India. First thing is close to 15, even close to 20% of the drugs in value are under control. In volume, it's more than that, of course. Because India has, for more than 10 years now, defined a list of essential medicines which are price controlled. And that's, by the way, one of the main explanations why the India market, pharma market, is comparatively lower, is that you have to have in mind that according to public sources, if I compare the price of average drug in India versus China, you will have a delta of 3 to 5 times. So basically, what you would pay, €1 in India would be paid 3 to 5 euros equivalent in China. So that's a massive difference, explaining that, for instance, Sanofi is having probably the same volumes of sales in India and China, but obviously not the same turnover. So that's on the good side, of course, because it means even the population with, a limited income is able to treat themselves. I mean, as an anecdote, as a foreigner, when I arrived in India and I first went to the pharmacy, I was amazed that if you take 1 tab of Combiflam, which is the painkiller I mentioned, you will pay a few rupees, knowing that you need 80 rupees to make €1. So it's incomparatively lower than any equivalent you will find in Europe or the US. There is a price revision which is done every 5-6 years, which allows to make sure that when the list of essential medicine changes, they're able to make sure that what is really essential for the population is under price control, so that you maintain accessibility for most of the population. The revision was some time ago, so it is expected probably to come next year. And then there are some thinking about trade margin cap, which is not such a big impact. The reason why it's important in this pricing story is that India is probably one of the very few countries in the world where the price level of drugs is at a very low level, which is rather increasing than going down. Again, to compare with China, which is just a neighbor and comparator, the prices in China were so high that, they've been decreasing on a number of therapies in the last few years. And it's not the case in India. So the reason is positive is that it means as a company, while there is a good accessibility for the patients, for a company, there is much less risk that you come in a country and invest to see your prices going down by 20% or 10% every year. It's not the case. The correction, the price correction and adjustments to the affordability for Indian patients has been done to a very large extent on essential drugs. Second theme is the access part. I'm not going to detail everything. I think the main one to have in mind is Ayushman Bharat, which is a kind of universal coverage fund, because I think Ravi mentioned that 2/3 of the health spent in India is out of pocket, meaning that really people don't have insurance to pay for that. And Ayushman Bharat is a program that is aiming the poorest 500 million Indians. So, 500 million is quite a number, which will basically get access to 6,000 euro annual coverage. Corresponding to the cost of hospitalization or drugs in India, it's quite a good amount, good coverage for an Indian family. And it's of course a very strong social message that is being sent. The drawback of this is the cost of financing is huge, and the program has taken a bit of delay, especially during COVID situation. But it's let's say an effort towards a kind of universal coverage for at least for the poorest part of the population. In terms of business, the impact of that is that it means there will be, especially for the people who are coming with a price competitiveness perspective, there are massive volumes of tenders that will come to be able to match the prices that will be required to treat all these patients. On specialty care, India is actually relatively advanced in terms of specialty care coverage, but it's still a very state-wise treatment, which they were trying actually. I should have updated the slide. It was supposed to be approved in 2020. Once again, I think it's slightly delayed because of COVID, but there are important steps toward this. In terms of new platforms, I'll just have a word on more the evolution of e-pharmacy. So we have a very strong, very active e-pharmacy sector in India. Surprisingly, in a way stronger than the modern trade. So in a traditional pharma evolution, we've started with unstructured trade. which then structures into big groups. I mean, we don't have that in France by law, but in the US, all the Walgreens, CVS, and so on. And then later came the pharmacy. In India, we leapfrogged also on that because the usual trade is very unstructured for different reasons, including regulation that prevent any foreigner to invest into creating such big trade companies. And therefore, I mean, actually, there was a real need for something which was a bit more modern with a higher service, which is important in India. And e-pharmacies are thriving on that. And we're talking not only consumer product, but also prescription products. You have to, I mean, 1mg or others where you have to put the scan of your prescription on the website to get access to the drug. So it's already working. There were a few back and forth, but it's working quite well. And this was good news in a way because it means that in India, as in several major countries, in the time of COVID, there was already an infrastructure ready to manage telemedicine, and most of these online pharma, they are able to do some teleconsultations, which was proving very useful during COVID. Then on quality and self-sufficiency, there is obviously a strong, I mean, pharma has always been a strategic sector for India, or not always, but for the past 10, 20 years, which explains we have strong manufacturing backbone in India, both for API, so active pharma ingredient, but also for the finished products. There is a continuous evolution towards more quality and so on. So these are the main trades. And then I wanted to just step back and say, okay, after I've been spending 2 years in India, in Mumbai, and I wanted to share a few thoughts before I'm being cut because I don't know where the time is. The first thing is there are obvious reasons why India is an interesting market, and I mean I'll mention two that are the usual ones that we know. Most GDP projections show that India will be probably number 2 or number 3 in the next 30 years, far beyond Europe, and I mean bigger than the US. And the second thing is it's in terms of people who are actually able to address, I mean to treat themselves with the right, I mean who have enough actually money to treat themselves. The reality is that not only the GDP is increasing, but there is also a general improving on the situation. Meaning, we started like 15 years ago with a very strong basis of low and lower mid-income, which is gradually actually transforming into a pyramid that is much closer to the one we see in major market. And this is continuing. It's still a struggle, but we do see this progressive enrichment of the population, and I mean all of this means they have access to more products, of course healthcare, but we're talking also this is important for consumer products and other things. So that's the obvious reason why India has been interesting. There are 2 other reasons which I find interesting, and maybe I'm a bit biased as a CFO, but the first one is a bit like China, by the way, there is a very stable currency. And those of you who have been exposed to Latin American markets or to Turkey, to Russia, they know that, sometimes it's a bit of a monkey money because you have a very nice growth in local terms, in terms of sales. But in reality, this is mostly inflation, and you end up paying it in the euro to local currency evolution. Which was true in Brazil, in Russia, and I mean there are many other examples, especially in the past few months. And it's not the case for India. The INR is quite stable. Just to give you an illustration, in the past few months, in the last 4 months, the repo rates, basically the interest rates, went down by 3 points, which is huge. Huh? It went basically from 6 to less than 3 points. And despite that, the currency lost only something like 2 or 3% versus euro, which is comparatively very small. And this shows that I mean India has a very strong basis of economy, a very strong local market, which protects any investment that you do in India in the long term. Because 1 euro worth today is probably going to be close to 1 euro worth tomorrow. The second thing which is interesting is the massive pool of graduates. I mean, it's not very visible from France because they never go to France. But if you work in the US, especially in the East Coast and other parts, you will see the amount of people who are coming from the Indian, higher education system. On the other hand, I mean, the education of younger children, of poor children, is very much an issue. But there is, on the other hand, a very strong secondary system. I mean, just for the joke, if you have time, look at the CEO of the top 10 tech companies, whether it's IBM, Google, and so on. You will see the proportion of people actually who started, who were high school students in India is quite massive, or at least uncomparable with the population, the rest of the population proportion. So it's an opportunity because it means for ITS, of course, but beyond ITS, you have a massive pool of talents, and some companies have really embraced that logic, by the way, because if I take Novartis, for instance, they have a big center in Hyderabad, which is one city close to the center east, 4,000-5,000 people who are managing activities for the rest of the company. And here I'm not talking about what typically Accenture or others will be doing. We're not talking about BPO, which is more on a transactional basis. I'm talking more high value add activities, including medical writing. So people who are trained doctors doing this and so on, because you have a high quality education system, but the salaries are relatively still low. Last 2 points, last two slides I wanted to share. There are also challenges that one has to know. There is a saying of incredible India, and it's true that you see it day to day. One is the pace of restructuring of the economy. It's been a revolution which started in around 1991. Before that, it was a very atone economy with a lot of issues, and there was a big liberalization in 1991. Even in the last 5 years, we can see the pace of change, which is sometimes hard to cope with. And I'm giving a few illustrations in the last 3 years. Demonetization. So imagine imagine that you're in France, and overnight the government tells you all your bills, tous les billets from all the notes, all the banknotes from 10 euros to 500 euros are not worth anything anymore. You have to go change it in a bank. And if you have more than, let's say, 10,000 euros worth of notes, then you need to justify every euro of this to make to be able to change it. So that happens 4 years ago. 1 year later, GST, which is a good thing. It's basically a VAT unification system, but it's been a huge revolution for the finance activities in India. The corporate income tax rate was cut by 10 points last year. It was among the highest countries. It's now about, among the very competitive countries. And then you have all the Make in India laws that are promoting local production and so on. So the pace of these structural reforms is very fast, and you have to stay alert because things can come as a surprise. And then there are of course challenges for the country that we know. There is a massive underinvestment in infrastructure, which means especially roads, trains. Not so much airlines, because the airline were developed, and I'm just talking about logistics here. There are more things. There is a social challenge which is very hard to tackle, which is basically how do you transition from a very agriculture world to a service and production activity, knowing that you have to give a job to to millions of people every year because of the size of the market we're talking about. And then of course there is pollution, which is still pollution, or in general all the ecological issues that are quite pregnant in India. Last, just to give a few last comparisons. India is not one country in the sense that we think about when we think of France. Actually, it's in reality a kind of hybrid model between Europe and between EU, and the US. you have very strong states, and because these states are usually, I mean, they're sometimes of the same party as the prime minister, but not always. You do see many things that actually are decided at the central level, but never get implemented in some states, or there are some even some political issues from one state to the federal government and so on, which is never seen at the country level in France. This has a big implication, which is for instance, if you're launching a product in India, the people you're gonna have in front of you when you're in Maharashtra, the state of Mumbai, are not the same as the one you'll see in Chennai, which is in Tamil Nadu. These are different populations. They don't speak the same language. I mean, you all know that there are dozens of language in India, and in Hindi is actually not really the common language. It's more English than Hindi. So all of this makes it much more complex than just one country. So it's not like it's not one market of 1.3 billion inhabitants. It's 28 markets, I would say, or at least 3-4 big.
Just a second, Charles. Sorry to interrupt you, but we are running out of time. So if
I have 1 minute, so it's fine.
All right, thank you.
And the last thing I want to share is about the reform, the way of reforming, which is much more bottom up than Chinese model. In Chinese model, once the party has decided something, it gets implemented very fast. The pace of reform in India is sometimes much longer and in many cases much more progressive than in China. So I'm done. Sorry, Shweta. So happy to share this few perspective. I don't want to spend too much time on the market itself. I think Ravi has covered it quite well, but I want to share a few things about a naive view of Indian markets. I'm done, Shweta.
Yes, thank you so much, Charles, for this lovely presentation, and of course about your observations about our incredible India. Now, without further delay, may I please ask Prabhdeep Singh, co-founder, CEO of STANPLUS, to please present his story. Thank you.
Bonjour, good morning, good afternoon, everyone. My name is Prabhdeep Singh, and I am the CEO and co-founder of STANPLUS. We are a startup that has strong linkages with France because we were founded there almost. We were incubated there as well. And I will give you a startup's perspective on how it is to come from outside and create a company operating in healthcare in India. What has been positives for us? What have been the growth drivers? And how do we see the current technology trends as drivers for us? So a quick understanding of what we do. We are in the medical response space. India's medical response and emergency system is not as mature as in the developed markets. Each hospital enterprise runs its own emergency response system. It could be through a local partnership, or it could be through actually owning the assets and running the response system internally. We provide the hardware, software, and careware to manage the system better and to bring network efficiencies. And the big problem that we are trying to solve is that only 14% of Indians get an ambulance in case of a serious injury, which is more than 90% in the US, and 45 minutes is the average ETA. This is a huge problem that leads to about 150,000 people dying each year in road traffic accidents. 99% of cardiac events in India are fatal as compared to 70% odd in the US. And, considering the massive size of this problem, we basically were studying together, the three of us, one Indian, one Costa Rican, and one French guy. We were doing our MBA at INSEAD. You can see this is our convocation picture right in front of the Chateau de Fontainebleau. And we started as Uber for ambulances and got incubated by INSEAD. But then as we moved to India, we pivoted to a B2B offering. And now we work with some of the largest hospitals in the country, some of the largest enterprises that are global, but in India, and we help them manage emergency response. Of course, this is becoming now increasingly important with enterprises going from wellness to COVID management and emergency management. We own the experience. That means that we have our own contact center, we have our own ambulances, we have our own people, but we use technology to distribute. So it's a click plus mortar model, and we own the experience fully. We have raised $2 million in venture capital. We are profitable as of 3 months ago, which was a great time to turn profitable right as COVID hit us. And we are growing on a month-on-month basis at about 10%. And that just speaks about depth of the market. So what were the key lessons that we learned from our experience? How did we go about doing a macro thesis build? So one thing that we learned very early on is that there is a significant difference in the total market size and the serviceable market. So we've often heard the number of 200 billion as the healthcare market, with 75% odd lying in delivery services. But what we realized is that that's actually an important distinction to have, that what is the total market size in India and how much can we actually service. So if you're looking to India as a market, towards India as a market, please do your market sizing using the billion people lens, only if tier 2 and below are targeted. Charles also spoke about this, about the pyramid, that how a large proportion of the Indian population are still below the poverty line, but they are slowly moving upwards and towards spending a large part of their wallets onto healthcare. And that's about 75%. So at large, patients still pay for healthcare. What this means is that per capita, this is per capita instead of per capita revenue will be low. So what we can earn per patient, Charles gave a beautiful example of Combi Flam, for example, and how cheap it is. But then there's $1 billion worth of scale there. So we need to find cost efficient models. So when we were launching, we were trying to very eagerly find a cost efficient model. And we realized that to launch a startup in India that focuses on building health infra, but uses tech to distribute, actually is very cost efficient. And another macro thesis that we used is that patients are getting older, of course, like the world around us, but the non-communicable diseases are starting younger. So the average age for an Indian to get diabetes is much lower than that in the Western world. These long-term chronic diseases increase the patient's lifetime value in dollar terms, and for the company such as ours, this means that the emergency numbers will also go up subsequently. We also realized back then, this was 4 years ago, that this is the right time to invest or partner to participate in the growing Indian healthcare market. Of course, with today, with coronavirus, COVID tailwinds are significant. But as Charles mentioned, there are going to be some short-term pains on regulatory and on market stabilization. What were some of the micro realities that we learned along the way? What are the key lessons on that from our experience? One thing is that brand matters a lot. And post-COVID, it will be even more important. It's a key growth lever. And because it's a privately paid market, it's largely a private healthcare market, the importance of brand cannot be understated. Second, regulations are becoming proactive. They are not there yet, but they are becoming proactive. You can view them as largely pro-industry if patient interests are not opposed. So when it comes to patient interests, they take precedence, but they're largely pro-industry. The government wants private operators to exist. There is a populism wave, but government is not wanting to bring all the healthcare into public domain. So even Ayushman Bharat, for example, has framework for private industry players to participate. However, having said that, intention is not equal to implementation. So what you read on paper as policy may not be what you see on ground as implemented. So that line has to be seen on ground. Your largest competitor, our largest competitors, are not pan-India plays. For any healthcare company operating in India, the largest competitor will be the smallest local player. It's going to be the local pharmacy, the local general practitioner, the generic upstart, a small clinic, a diagnostic lab of neighborhood, or a tech platform that serves a single hospital or a single neighborhood. This was a big learning, because when we came in, we were looking at the macros and the macro players and macro population sizes. But what we realized is that for us, competitors exist in each and every neighborhood. Every small neighborhood has a local ambulance operator. Every city has hundreds of ambulance providers, and each and every hospital wants a very key, they want to own the piece of this. And I think this is something that has been a phenomenal learning experience for us, because now rather than think of these participants as competitors, we are thinking of them as partners or franchisees, so that allows us to distribute better. So dissonance between point 1 and 3, that the brand matters and yet largest competitor is the smallest local player, is actually why brand matters a lot. So if we as a company, as Red Ambulances, as STANPLUS, and you as a participant, you can think of the local competitor and yet build a brand that is pan-India, that's an amazing advantage to carry. This was a great learning experience for us. So what did we do well as we entered the market 4 years ago, as we started growing, is that we found our vertical. Healthcare is, healthcare is a very, very horizontal, it's almost like F&B, like food, there's restaurants and there's food, but healthcare is similar. It's a large healthcare horizontal, but we found our vertical. And also we localize, but with international prestige. In India, international prestige matters a lot. So when we came in from France, we did play that hand. We also played the hand that we are headquartered in Singapore. That mattered a lot to people who were coming to work for us. It mattered a lot for our customers. We believe that global products do succeed for Indian problems if good value is provided. Example, Kia versus Renault in India. Kia entered 2 years ago and is already the 3rd largest automobile manufacturer. So what we did for us is we said, we are going to look for localized solutions, but state-of-the-art equipment are needed. So we have world's best equipment in our ambulances, but we have very localized solutions. That's point 3. Global services often fail for Indian problems if not localized. International SOS is a great French company. That's an example. Could not Indianize soon enough. And we as competitors of theirs are building local solutions, but with global quality. And that's what we've realized is the biggest value driver. If you can give a local solution with a global product and global quality, that's a very important key value in the Indian healthcare industry. 4th point is that what we realized is distribution is a huge moat in India. Access is a key growth driver. So access, how we define is, are we present and are we offering value? So like Charles mentioned, we are 28 markets, not one. And if we are in India, doesn't mean that we are in every neighborhood. So we have to be present locally, and that's where we use technology for. And we believe access plus technology will be a great value driver. How are we taking advantage of COVID? Because we genuinely believe, and it has actually translated in our revenue numbers, is that COVID is a tailwind for the overall healthcare industry. However, what we realize is that COVID is a big worry for large enterprises, and we suddenly have new problems to solve. And the likes of Infosys with 70, 75 centers, they need scalable healthcare solutions that are pan-India. And for example, we are building centralized COVID management for them, centralized emergency lines for them. Then for COVID, we've realized that prevention, detection, and management are all verticals within COVID that we could play in. Then there's, of course, distributed healthcare delivery. Earlier, we were protecting employees in office. Now we are doing work from home coverage. So earlier, we were protecting one office space. Now we're protecting everyone in the country. Then at the same time, there's a play here. The prices in healthcare over the next few months, we expect to go up because the input costs are increasing with PPEs and sanitization standards increasing. But at the same time, there's alternate payers that are willing to step in. So more and more enterprises are willing to pay for COVID. COVID is fully covered by insurance now. So we've seen an increasing pricing wave, but at the same time, we've had alternate payers that have stepped in, which is in a way good for the industry because it's leading to overall market size increase. Those are very, very micro lessons for us, and I'm happy to answer any questions that come up. Thank you.
Thank you, Prabhdeep, and really sorry for asking you to keep it short. We do have a question for you. It is, would you consider the diversity of your management team key to your achievements?
Absolutely. We genuinely believe that it added what I mentioned, the international prestige and localized solutions. Antoine and Jose came in wanting to build a world-class, state-of-the-art system. And I had worked in the healthcare industry before, and I brought with me the knowledge of the local markets, and both of those combined very, very well. And this is an experience that I've seen in a lot of MNCs around the country as well. The more they're able to localize, but yet keep the global ethos on quality and value addition, that's a great win for any company that's operating in the country.
Thank you so much, Prabhdeep. Given that we're running out of time, I think we'll have to end the session here. But before I do so, I would genuinely like to thank all our speakers for taking time off today and for sharing their expertise and knowledge with the participants. And thank you so much to the participants for having attended our webinar. If you have any questions, please feel free to write to us and we'll be happy to respond. Thank you so much. Wishing everyone a lovely day.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.